Good morning. The health and safety of those affected by Tropical Storm Debby and the Ogeechee River flooding are our top priority. Please listen to those here today who are experts. The response to this storm and the following floods that followed was an effort on the part of Chatham County across many departments including SEMA, mosquito control, animal control, Chatham Fire, Chatham Police, Public Works, Engineering, the Department of Public Health, and countless others throughout the county and our employees. And to that we say thank you and we appreciate what you have done. Over the course of this storm, I have seen the resiliency of the residents of Chatham County, and I want to make special notice to those who volunteered and their time to help immediately after the storm and throughout the flooding. I also want to make special notice that Compassion Christian Church has opened a resource center for those affected by the storm. If you need help, we can help you there. And so now I'm going to call on Director Dennis Jones, who will tell you more about that response, and then he will introduce all the others.
Thank you, sir. Good morning, everyone. So our situational update, water levels are receding throughout the county. You should be able to see, bear witness to that. There are some areas throughout the county that are still have some flooding impacts, though, and we are monitoring those areas and those communities. Highway 17 at the Ogeechee River is still closed. It will remain closed until the Department of Transportation can get in and do a bridge inspection and determine that it is safe to travel across. So yesterday, the Federal Emergency Management Agency, the Georgia Emergency Management Agency, as well as the Small Business Administration, they were in the area doing damage assessments based on individual assistance. So we spent the day with them yesterday, taking them to various areas throughout the county and ensuring that they had good situational awareness of what our damages for individual assistance look like. At this time, there is not a FEMA individual assistance declaration. Okay, so they were here doing that damage assessment yesterday to determine if the state as a whole would meet the thresholds in order to qualify for an IA or an individual assistance declaration. So we're starting the process to work through those numbers and that data collection. And they'll be doing that through all of the counties that have been affected by Debby. And hopefully we should hear something back from FEMA by the middle of next week. At this time, again, there is no federal declaration for individual assistance. Mosquito Control has done some assessment overflights for us just about daily. So we're very thankful for the efforts that they've been able to do. It gives us really good situational awareness of what the flooding looks like. What the flooding looks like from day to day and also from hour to hour as needed. And they've also started doing some preventative measures, which I'm sure Director Carlson will talk about. We are entering into recovery, and as we enter into recovery, the chairman did mention the resource center that is open up at Compassion Christian. It is in their adult ministry center. It's at 50. It's at 50 Al Henderson Boulevard. They are offering food, water, cleaning supplies, personal hygiene products, and other resources. They will be open this Saturday from 4 p.m. to 8 p.m. And then next week, they will expand their hours. They will be open Tuesday, Thursday, and Saturday from 7 a.m. to 9 a.m. and again from 4 p.m. to 8 p.m. We also have a company that's in the area called Crisis Cleanup. And if you need some assistance through Crisis Cleanup, that number is 1-844-965-1386. Again, 1-844-965-1386. And also, finally, the United Way has set up a rapid response disaster fund. If you need some immediate funds for some immediate recovery issues, you can get in touch with the United Way through calling 211. Okay? So that's all I have. I would like to bring up Dr. Bonzo Reddick to talk about public health.
Thank you. So my name is Dr. Bonzo Reddick. I'm the health director for the Coastal Health District, which are the 8 counties in the Department of Public Health in Southeast Georgia. And Chairman Ellis already kind of mentioned all the folks that are involved in this, and so I'm not going to rehash that, but I do want to thank everyone, county and city officials, all our different staff, all our different agencies that have been involved in this response, which is obviously a collective, concerted response. I did want to talk about 3 specific things. Dr. Rustin, who's our administrative director of the Chatham County Health Department, is going to go into more detail about the public health response, but I want to talk about 3 things from a standpoint of a physician. So number 1 is that obviously with the floodwaters that are there, there's a lot of temptation for people to go and play in them. So my son's basketball practice this weekend is right next to an area that flooded right off of Highway 17, and I saw some little kids playing in the water during that time. And the problem with floodwater is that it contains a lot of animal and human waste. There's a big risk for infection if you wade into it. And also there may be sharp objects that you can't see in the water that can poke you, that can injure you that way. So we strongly recommend that no one goes into the floodwaters unless they have no other option. And really definitely avoid having children or anyone else play in the floodwaters. That's kind of the first big point. Now with that being said, we just heard about the brave volunteers that are involved in some of the rescue efforts and going in to help people. So for some people, it's not avoidable, or you might be stuck in your home and have no option but to go into the water. So that leads to my second 2 points, is that if you have to go into the water, making sure that you protect yourself as much as possible. So one way of doing that is to avoid the risk of mosquitoes, mosquito bites and mosquito-borne illnesses, which I'm sure we'll hear about in a second. So, and you'll probably hear some more details, but the main things are using really evidence-based insect repellents, DEET or picardin or something like that. Lemon oil of eucalyptus works pretty well. Doing something to prevent yourself from getting mosquito bites in the first place. That's the best thing you can do. Now, I know some people have asked questions about West Nile virus, and there's some mosquitoes that have West Nile virus. There's no specific medication you can take to prevent it other than not get bit in the first place. So there's not any medical treatment you should seek to prevent a mosquito bite other than the repellents that I mentioned. In addition, if you are bit, there's not a medicine you can take afterwards that will prevent you from developing West Nile virus or some other types of mosquito-borne illnesses. So the best thing to do is try to avoid it, try to stay out during the hours where mosquitoes are more prevalent, during those early morning, late night, kind of dusk and dawn hours. Wear lightweight long sleeve clothing if you can. Just do all the things you can to prevent from getting bitten. And again, the best thing to do is stay away from those flood waters. Mosquitoes love pooled water, essentially. So again, the big things are not wading in the water if you don't have to, trying to avoid mosquito bites, and then last but not least is that if you do have a skin injury, you get a nick or a cut in the water, which has been very frequent among our volunteers, is that being sure you get a tetanus shot within 48 hours of that exposure. So, so that is available at the health departments. A lot of people's primary care physicians or primary care providers carry tetanus shots as well. Urgent cares have them, but within 48 hours of the exposure is the best time. Now, if you for some reason go past that 48 hours, should you still come in? Absolutely. So still come in, but the goal is really to get it within that 48-hour period, because the incubation period for tetanus can be as short as 3 days or 72 hours. So just trying to stay out of the waters if you can, trying to avoid mosquito bites and mosquito-borne illnesses, and if you do get nicks or cuts, go ahead and get your tetanus shot. And if you know you're going to be in the water and are at high risk and you have access, go ahead and get your tetanus shot ahead of time just to be safe. Tetanus shots are good for about 10 years, so if it's been more than 10 years, then go ahead and get your tetanus shot. Again, available at the health department. Dr. Russell will tell you some more details about specific places and times you can get those as well. So again, thanks to everybody in the community who's been a part of this effort, and everybody out there, please stay safe.
So first of all, I want to thank all of you for being here to help us carry this public health message that we're talking about today. My team that's here today, in addition to myself as the director of the health department, I've got our nurse manager here, Dr. Sierra Peebles, as well as our environmental health manager here, Lauren Baker-Newton, and they're both available to answer questions about some of the things I'm going to talk about. As Dr. Reddick had mentioned, we're very concerned if you receive cuts or scrapes or step on a nail about getting a tetanus vaccine. One of the things that we do in the health department is we offer the tetanus vaccine on a routine basis, but specific to this event and for individuals that may have been injured or cut or scraped as it relates to the flood that's happened on the Ogeechee River, we are partnering with Compassion Christian at the recovery site on Al Henderson Boulevard to offer on-site tetanus vaccines. Our team will be available on Tuesdays and Thursdays next week from 4 to 8 p.m. We'll have nurses on site. You don't have to have an appointment. and there's no out-of-pocket cost for folks who need to get this vaccine. And so again, that will be at the Compassion Christian Tuesdays and Thursdays from 4 to 8 p.m. In addition to that, we're also offering walk-in services at both of our health department locations. And so you can walk in, let them know you need a tetanus vaccine, and we'll work you into the schedule to get that vaccine here at the health department. In addition to the health department locations, you have urgent care facilities, your private physicians' offices, as well as some pharmacies offer that vaccine as well. And so we just want to encourage people who may have received an injury, cut, a scrape, a nail puncture, that they consider getting that tetanus vaccine. As Dr. Reddick had mentioned, obviously anytime there's a flood event, there's going to be mosquitoes. We have a very fantastic mosquito control program in Chatham County, and they're certainly doing everything they can to reduce the number of mosquitoes. But there will be some standing water around even as the floodwaters recede. In addition to protecting yourself by wearing those evidence-based repellents, we recommend that if you have anything around your home that's holding water, something as small as a bucket, tires, anything that holds water, a lot of those species of mosquitoes that bite you around your homes are breeding in those little small containers. And so we can certainly help ourselves by dumping those containers, and that will reduce at least some water that those mosquitoes can thrive in. And so as you walk around your house, as you start assessing the damage, if you see things holding water that you can dump out, we recommend that you do that. Another thing that comes up quite often during a flood event is what happens with molds and mildews. All mold needs is water, and so if your home was flooded, most likely you're going to have mold in the home. There's a lot of education from CDC and from the EPA on what you can do about mold. If you have materials that are porous and they've been flooded, those can't be cleaned. They're going to have to be torn out and they're going to have to be replaced. But most importantly, as you're working in your home, protect yourself. We don't want people inhaling mold spores in their lungs. Wear personal protective equipment. Wear a mask, wear goggles, wear gloves. And most importantly, we use a lot of bleach when we're cleaning up. Don't mix chemicals. Don't mix bleach with ammonia. Don't mix bleach with some other chemical that can create another problem for you. Well water is another concern that we have after a flood, especially in those areas of the county where you get your drinking water from a well on your property. If your well has flooded, because it's in that flood area, you need to assume that the well is compromised, that it's been contaminated. We strongly recommend, once you get power back, that you flush the well, meaning you run water until it's clear, and then that you disinfect the well. Usually we recommend non-scented household bleach. We have instructions on our website. We're going to be providing flyers on how to do that, but our environmental health team here at the health department is educated and trained on how to disinfect the well, and we can provide assistance on that. Once you disinfect the well, we recommend that you have it sampled. The health department will be offering free water samples once you get to that point. If you call our office, our team will make an appointment to go out to your property and sample your well, and we'll get results back to you pretty quickly on the quality of your water. And our samples will test for general coliform bacteria as well as E. coli bacteria, which is an indicator of a potential problem in your well. The last thing I want to mention is septic tank systems. We're starting to get calls about septic tank systems failing. Septic tanks obviously don't work underwater. They don't work well when they're flooded. And with septic systems, it's a weight game because the septic system has got to dry out. And so what we recommend with septic systems is trying to consume or conserve as much water as possible to limit the amount of water going in your septic system. Once the floodwaters recede, if you can get a pumper in to pump the tank, that can give you some relief, but it just has to dry out. And limiting the amount of water going into that septic system is one way that it can dry out. If you continue to have problems, our environmental health team can help with that as well. We can provide an assessment of your septic system and make recommendations on what needs to be done to that in order to repair that septic system. As echoed by the chairman, by Dennis Jones, by Dr. Reddick, I want to thank all the partners that have worked with us and that continue to respond, especially Compassion Christian, for allowing us to be on site and offering our tetanus vaccines. And with that, I'm going to turn it over to Turi Carlson, the Director of Mosquito Control.
All right. like everybody has said, it is floodwater, so there are a lot of mosquitoes out there. We noticed a big nuisance hatch of mosquitoes. Now, these are the mosquitoes that don't necessarily transmit disease, but there was a very large number of them that hatched on Monday. So, of course, our response, we only have one response to adult mosquitoes, and that's to do treatments, space treatments for those mosquitoes. So the helicopters are running, the trucks are running. We're 6 to 7 days a week. Helicopters generally in the evenings right at sunset when most mosquitoes fly, so we get our best kill at that time. That's why our helicopters are flying right around sunset. And then the trucks are generally running in the mornings right before sunrise, which is our other optimal window to reduce mosquito numbers. It was a West Nile season before the storm hit, and it's going to continue to be a West Nile season after the storm. Whether or not we kind of stay leveled off with the virus is yet to be determined. So we're a couple weeks out from really knowing those answers. But as the floodwaters start to recede, we switch from nuisance mosquitoes to vectors mosquitoes, those that will transmit disease or are able to transmit disease. This is historic levels from my understanding down along the Ogeechee. So where those water sites are kind of unknown to us. That's where our helicopters are coming in with assessment flights as well. So we're trying to figure out where water's standing now. Once we hit the 2-week mark on the receding end, we really start to worry about the southern house mosquito, and it loves just standing, stagnant, smelly water. You talk about septic tanks and septic systems failing. If there's sewage in the water, these mosquitoes love it. So our preemptive response going forward is we're going to knock down the nuisance mosquitoes, and we're going to start monitoring for those vector mosquitoes. We're going to try to figure out where they're at and how we can control them and really limit the transmission of disease. So other than that, it's like everybody else has said, it's time to break out the EPA registered insect repellent, long sleeves, long pants, light colored clothes, and by all means, if you can get in your yard, start tipping out anything. We know the bulk of the mosquitoes might not be coming from your yard right now, but if you leave that standing water there, that'll change very quickly. So get out in your yard and tip all those things out, and we'll try to clean up this mosquito mess as soon as we can. So we're trying to make it possible for the responders to get out to sites and not be bothered along the Ogeechee River, and our missions will continue for the foreseeable future. But that's about all I got.
Let me have Ms. Newton, you come on environmental. Come on. There you go. Introduce yourself and tell them.
Good morning. My name is Lauren Baker Newton, and I am the Environmental Health Manager here with Chatham County Health Department. Just echoing what our Administrator, Dr. Rustin, has said. If there are any specific questions that you have related to your property, please give us a call in Environmental Health so that we can assist. With regards to septic systems, as I said, just echoing, allowing it to dry out before we can get in there and really assess whether or not it is a situation that will require repair of the system. With regards to the well water sampling, we are here to assist, whether that is with the sample collection, or if that is assistance with chlorination of the well as well. So again, if assistance is needed, please do not hesitate to reach out to me and my team.
Dr. Peoples?
Good morning. Again, Dr. Sierra Peebles. I'm the nurse manager here over the clinical services for the Chatham County Health Department. Again, echoing Dr. Rustin and Dr. Reddick, if you have been in the floodwaters, if you have gotten any injuries, please let us know. Please come into our clinic and we can provide that tetanus vaccine to you. If you're unsure if you've had a tetanus booster in the past 10 years, no problem. Give us a call. We can look up your records to kind of see when that last one was and to give you some advisement on how to proceed. And as well, we will be at Compassion Christian next Tuesday and Thursday from 4 to 8 p.m. Please come on. We will get you that vaccination. If you have any other questions related to health during this flood, again, just give us our office a call and we can advise you. Thank you.
Let me just say on the day before yesterday, on Wednesday, the health board met in the same room, and we felt it necessary that we bring these things to you because we are in the point of recovery, and a lot of times folks don't really realize what they need to do, all right? And having witnessed folks wading in the water, children playing in the water, there's a need for us to bring an awareness of the aftermath of what the cleanup is, all right? It's just not opening the roads, it's just not the water going away, but as you can see, we have gathered those who know, who are experts in the field, who can tell our citizens and our residents what they need to be doing now and what they need to be cautious of, all right? So the more information we get out, the more the public lets us know just how their area is affected, because they live there, we visit there, we are there to see what went on, what's going on, but we need them to tell us because they're there on a 24-hour basis, all right? So with that, I'll take any question for any one of the panelists that you want to speak. Yes, sir.
Director Jones, can you just speak more on the federal aid portion of things, right? Because we talked about how the teams were out yesterday. They're assessing that's going to go to the governor, and the governor sends a letter to the president. We hear so much about this threshold that we have to meet. What is that threshold? Is it a dollar amount that needs to be as far as damage is concerned? Can you just kind of talk about that aspect of the aid part of this?
Sure. So to meet the criteria for a presidential disaster declaration, you have to meet certain thresholds. Those thresholds are monetary thresholds based on per capita. So every year the number changes, so it's a certain dollar figure based on the population in Chatham County. That's the first threshold that has to be met. And then there's also a separate dollar figure based on the population for the state of Georgia. So that threshold has to be met as well. So both of those thresholds have to be met before we can actually qualify for a presidential disaster declaration. So for Chatham County, that threshold is right now 1.3 million for this year, and the state threshold is right at 20 million. So both of those have to be met before the president will even consider a disaster declaration.
And as far as the president giving us a thumbs up or thumbs down, whether or not we need that, you said middle of next week, we should know.
I'm anticipating that. FEMA was in yesterday. They saw everything that they needed to see for the IA declaration, individual assistance. So they are doing these same things in the other counties that are affected by Debby. So just depends on what that schedule looks like. And then they have to take that information back. They have to get information from the state, compile all of that data, then present it to the federal government. So I would anticipate middle of next week. That's just my anticipation. That's my speculation. It could be the end of next week. It could be the first part of the following week. But hopefully within the week we should have a good clarifying path forward.
Any other?
Yeah, I mean, as far as the flood-related illnesses are concerned, I mean, what specific types of illnesses, aside from tetanus, can people get from wading in those floodwaters? What are symptoms to look out for? How quickly do they develop? And have you all seen any reported, I guess, visits to your office, to the local hospital as a result of flood-related illnesses in the past couple of days and weeks?
Sure. So as far as the types of illnesses, there's a wide range of things. So we heard West Nile virus mentioned earlier, which a lot of times gives really nonspecific flu-like symptoms. So people often have fevers, headaches, maybe some muscle aches, joint pains, that kind of thing. For some people, they have gastrointestinal illnesses. They might have some nausea and that type of thing, some diarrhea even. But it's very dependent on what each person has different symptoms. There are other things as well that can be spread in floodwaters. We mentioned tetanus, which is a relatively rare condition thanks to the tetanus vaccine. There's only about 30 cases of tetanus in the United States every year. Total in the entire country in all 50 states, so we do not want any cases in Chatham County. But there are other bacterial infections you can get as well. So simple staph and strep infections you can actually get from being in the water, especially if you have an open cut or a wound. It can get, you can have a high rate for wound infection. So symptoms to look out for, I mentioned fevers, headaches, especially high fevers, but also if you have any cuts or scrapes on you that are that look like they're getting infected. So signs of wound infection are things like increased redness, increased pain in the area. If it starts draining fluid, especially if the fluid looks like pus, those are indications to seek health care immediately. Thank you.
And have you seen any reported
yes.
cases?
So there have been some reported cases, but not of the other things like West Nile virus or anything like that. But we have seen cases of a lot of wound infections or people with cuts and scrapes and blisters and things like that from who've been wading in the water. So that's probably our biggest risk, is just the skin infections that can happen, and also the potential harm from being around that dirty water that, again, often has human and animal waste in it, so do not play in it.
Yeah. And just while I have you, I mean, yesterday,
Sure.
the city of Savannah announced that there was a massive sewage spill. About 500,000 gallons of sewage was spilled, between, I think it was August 5th and 7th. I mean, does that raise concern in your mind, given how populated that area was
Sure.
where it happened?
So the one thing we do is really just make sure we educate people and not to have people panic per se, because a lot of times when something like that happens, people say, I need to go to the doctor and get some kind of treatment to prevent an infection. There's not a specific thing you can do in that situation. If you had to get in the flood water, there's no specific medication you should take to prevent infections. It's just knowing what things to look out for, and if you do have any symptoms of it, just seeking care immediately. So we tell people not to panic, but also still be vigilant as well. Thank you.
All right, anything else? Yes, sir.
Yeah, sorry.
You coming?
Just while I have y'all.
Yeah,
For mosquito control.
okay.
You mentioned that this was a very intense season as far as West Nile was concerned prior to the storm coming. So, I mean, we know that the helicopter and treatment efforts were hampered because of the storm. So how, I guess, much did it set y'all back? And how much is the concern level now given all of that standing water? I mean, like you said, it doesn't take a lot of standing water. It can just be a little puddle in a bucket somewhere. So.
Right, our concern level stays about the same so far. I'll put it that way. We're monitoring, we're running our traps, we're collecting mosquitoes, we're still testing, we're doing everything we do that we've been doing. So we haven't had to increase, I guess, our concern about West Nile. The nuisance mosquitoes are our biggest thing out front. That's putting us behind probably a little bit on West Nile control because the nuisance mosquitoes are countywide. West Nile was really focal in the midtown, downtown. It was, everybody should take precautions against it, don't get me wrong, because especially after this, it's going to bubble out probably just about countywide. So we're trying to get everywhere we can, but right now we're it's just we're trying to cover 237,000 acres, and we're doing it in chunks. So we're coming, and we're going to try to keep those West Nile mosquitoes down, along with knocking down the nuisance mosquitoes. So right now, it's kind of our efforts are adding onto each other, which might be a little bit helpful. It might not blow up our concern in the next couple weeks. So at least that's what we're hoping for. So monitoring continues.
Okay, got everyone's questions answered? Let me say that our main reason for having this press conference is to bring awareness of where we are, all right? We are continuously gathering the data in our environment and in our living area, in our living space, and we continue to have the ability to meet the needs, all right? I think Director Jones asks me every day, do I have any needs, all right? And so I look to the residents. If there is a need to get in touch with us, it will be on our channels, it will be on our websites, and we hope that you will put the information on there. But we are asking the public not to panic, all right? This is not time for panic, but this is time to be educated about what happens after the storm. All right, the storm has passed, we're into recovery, and it takes time because we have to gather the data, all right, and send the data to the state and then the state to the federal. All right, the federal have been here, they have done their evaluation. The local SEMA continues to do evaluation, I want to say hour by hour. And so things will change. And if things change, we will let you know. We will keep you abreast of what's going on. But we ask you to please, one of the things that all of our departments who are at work, all of our volunteers who are at work, they need your cooperation, all right? So be compassionate one to another, all right? And don't go off. But there is a solution that we're working on, and so you can tell from those who have gathered here how we're doing, especially those folks on the west side who have wells. And if your well was compromised, you know that there are certain things we need to do and certain things you need to do. And we have people here who can get to the answer to your questions and the answer to your concern if we all work together. Again, let me thank you, and let me say to our general public that we're continuously working, all right, to meet your needs and to return us back to normal, if there's such a thing as normal, all right? And so we hope those things will take part in the next few days, but there is a process that everything must go through. And so we've got everybody still on standby doing their part, from the health department to SEMA to the public works to all of the departments of the county, gathering that information, even to you all in PIO who helps us to get this information out. And so information is the key, because knowledge has power, and the more knowledge they have about what's happening around them, the stronger we are together. And so again, I say to all municipalities and all residents, there's still one Chatham County, and we're working to improve the life and the health of everyone in Chatham County. Again, thank you for coming to us, and please help us spread the word. All right? Thank you all.